guys, my name's Nicole. In case you don't know who I am, I'm currently a junior at Fremont High School, and I've been wrestling since I was in 6th grade, so this would have been my 6th year. Recently at a wrestling practice, I fully tore my ACL, I partially tore my MCL, and I partially tore my lateral meniscus. So 2 weeks ago on December 15th, I got ACL reconstruction surgery, and since then I've been recovering. And it's been kind of a hard recovery, but I'm making this video so that in case anybody else has torn their ACL and they're going to have to go through the surgery, then they can have something to look at and they won't have to be as afraid of it because it's really not that bad. For the surgery, you're first going to go into a room and you're going to be laid down on a bed. You're going to have to strip off all your clothes and you're going to wear this gown that opens in the back. I was in the bed for about 2 hours before my surgery actually started. And that's because at the hospital, younger kids are put first because before surgery, you're not allowed to eat anything or drink anything except for water. So I think little kids have a harder time. My surgery started around 6. And they put an IV in my arm. It's your non-dominant hand, so for me it was my left arm. And at first it was just putting fluids inside, but then once my surgery was about to start, they put a little thing of anesthesia in the fluid bag, so that started flowing through. And for me, I immediately started seeing kind of blurry images and double of things, but that's completely normal, so don't worry about that. Right after, they wheeled me into the surgery room. And then this part's kind of fuzzy for me because I was already on the anesthesia, but from what I remember, they put me on a table and then they put a mask over my face, which I'm pretty sure was just more anesthesia. And then they put a catheter in my leg, like it's kind of like your upper thigh close to your hip. That comes with a little rubber ball that, I don't know, holds the anesthesia or something, and that'll flow into your leg for 3 days, and then on the 3rd day you're going to take it out. The surgery ended I think around 10 o'clock, so it took about like 3.5 hours, but it took a long time because there were 10 pieces of gauze and one of them was missing. So then the surgeon had to help find the piece of gauze to make sure it wasn't still inside of me. So that's what took a long time. It was pretty good because I was on the anesthesia. I didn't feel any pain at all. I just went home, I ate some pho, and then I went to sleep. So the day of the surgery is not going to be very painful. Day 1 after surgery, which I would consider the 16th, my surgery was on the 15th. Then I came home, I went to sleep, and then the next day is the 16th. So day 1, you're going to have no pain at all. The anesthesia is still going to be working pretty well. The catheter is still going to be in your leg, and it's going to be working the best at this point. So day 1 is technically the best day because you just don't really feel anything. You're not going to have much of an appetite because the doctor's going to give you narcotics, which are pills that help with the pain. But also narcotics come with headaches, nausea, and you don't want to eat anything. For me, whenever I sat up, I would feel dizzy and then I would kind of feel like I need to throw up, and that's what would happen anytime I stood up or tried to use my crutches to walk around. The 3rd day you have to take out the catheter, so that day is going to be the worst, so narcotics would be good to help with the pain. After around day 5, you should start taking ibuprofen and Tylenol because you will start to have more of an appetite without taking the narcotics. So the doctors are going to give you a brace that is like this. You're going to come out of the hospital wearing this. It's going to be in the locked position here. You can change it from locked to unlocked, and then unlocked it'll start bending. But for the first 5 days, you're not going to want to bend your leg at all. There's going to be a thick wrap around that is pretty hard, and you're not going to get it off until your post-op appointment, which for me was 5 days after the surgery. Also, you cannot get your knee wet at all, so you're not going to be showering for at least until your appointment with your surgeon comes up, and for me that was 5 days. So at the appointment, they're going to take off the bandage and he'll put this back on, and for me, I bent my knee to 60 degrees, so that is the angle at which he sets the brace to. But for somebody else, I don't know, it might be different, but that's what happened for me. On day 2, the anesthesia is going to start wearing off, but still you're not going to have very much pain at all. I was totally fine. Like I said before, the narcotics make it so you don't really have an appetite, so I wasn't eating much at that time, and it felt okay because the anesthesia is still working, the catheter is still working and stuff. So day 2 was fine, but then day 3 is going to be the worst because that's when you take the catheter out, so there's no more anesthesia flowing through your leg. And it's also around the time when the anesthesia totally wears off, so you're basically on nothing. and this is the day that I would recommend narcotics for. They're gonna make it so you don't have an appetite. You're gonna get headaches when you stand up, and your back's probably gonna hurt, and you're not gonna feel good at all, but it'll make the pain go away. So you can choose pain, or you can choose headaches, nausea, and other bad things, but you can make that decision yourself. But I would definitely recommend using narcotics on day 3, because that for me was the worst day. I did not feel good at all, but the narcotics somewhat helped with the pain. On day 4, the pain is definitely less than day 3. You're gonna start to feel better. Your knee is gonna start feeling more pain. So there's an incision like here, right below the knee, and that is the one that hurts the most for me. When I was wearing this brace, because it's kind of heavy, it sinks down a little bit, and for me, it pulled on the incision. Because of this, that is what has hurt the most, but you're not supposed to take it off, so you can't. On day 5, I went to the surgeon for my follow-up appointment, and he gave me this, which is a different kind of knee brace that is lighter, so it doesn't pull down as much, and this definitely helped from day 5 to like day 12, because that's when the incision hurt the most. There's straps on it, you can ask for it. I'm not sure what it's called, but the material is like foam, and it's very light, and you can start putting weight on it without it hurting with this brace. So 2 braces. Day 5, which was my follow-up appointment, you should be able to walk with the brace in the locked position with crutches. So you're gonna put about 50% of your weight on it, and that'll be pretty comfortable. As the days follow, you'll be able to put more and more weight. You have to make sure that this brace is in the locked position whenever you're walking around, but when you go to bed or when you're resting, it should be unlocked. In the first 5 days until your follow-up appointment, it should be locked all the time. So only after the follow-up appointment can you unlock it to a certain position. From day 3 to day 8, walking or just using crutches to kind of hobble around, for me it was very painful because of the incision underneath my kneecap, and that really hurt. From day 9 to 10, I was able to walk with crutches with very little pain, and then from day 11 to now, which is I think day 14, I'm able to walk without the crutches, and it's not very painful. I can use the brace that bends, and it hasn't been pulling on my incision, probably because the incision heals. On day 12, I had my first post-op therapy appointment, and at that appointment I worked on straightening, bending my leg, and I did a little light workout that includes partial squats and step-ups and terminal knee extension, stuff like that. And I have another video for that if you want to go check it out, but it's not up yet, so you can't. But it'll be up soon. Originally, I thought that the recovery process after surgery was going to be easy-peasy, no problem, but I was wrong. It was very hard. Day 3 was definitely the worst for me. I think it's a pretty hard recovery for this ACL surgery, just because you can't walk and it hurts a lot, and the narcotics make you have headaches, you don't really want to eat, stuff like that. But after the first week, it starts to get better, and if you're gonna have surgery, don't worry about it. It's totally fine, you can get through it. Also, you want to make sure that you're icing your knee as much as possible during this time. The doctor recommends 4 times a day, 45 minutes each time, and that's a pretty good amount. You want to ice it so that the swelling goes down, and then you could start straightening and bending your leg as soon as possible. Thank you so much for watching. I'm going to have another video up soon that is going to be the workout that I went through for my first therapy appointment after surgery. I really hope that this helps anyone who's also going to surgery, so you don't have to be too worried about it. It's definitely not that bad, and you'll get through it. So I'll see you guys next time. Thank you.